Hey everybody, hello and welcome to the coronavirus update. Alright, so you guys now, unless you've been living under a rock or literally never watched the news or talked to anybody or go on any type of social media, you've heard of the coronavirus or the COVID-19. That is the scientific name of this novel or new virus that has come out. I want to go ahead and downplay some of the hysteria that's going on right now and give you guys some of the facts about what it is that's going on. This is a new virus, which means that its infection rate is going to spread a lot more rapidly because there are no current immune antibodies that anybody has against this virus. But the same is true for newborns. For example, the first time that they contract a virus or something like that, their immune system then works and learns how to suppress that virus. Now, there's been cases reporting deaths from the coronavirus, and I want you guys to know that these are all for people that have immune compromised situations. So, for example, there was the first death in the United States reported the other day. It was a 50-year-old man who had underlying health conditions. All right, so the CDC is saying that only less than 20% of the population is going to have serious effects from this, and the rest of the people, the 80% of the population that doesn't have underlying health conditions, is going to have a normal viral type of sensation. So you may have some fever, you may have some chills, you may have some body aches, but you're going to then recover normally, just like you would if it was the flu. So the death rate is less than 2% currently. I've seen some numbers now that are saying that it's climbing towards 3%, but these numbers are especially coming from China. This is an upper respiratory infection. The virus really seems to affect the pulmonary system and the respiratory system. And let's think about the air quality in China for a moment, right? There's a lot of population and a lot of pollution, and therefore the risk is higher for death and serious complications from a virus in China. I believe that in the United States, we're going to see less death occurring, and we're going to see hopefully more people being proactive about their healthcare. And that's really what this is about. I want you guys to know that there's a lot that you can do prophylactically to avoid any complications from contracting the virus. So yes, you want to wash your hands. Actually, I would recommend that you avoid sanitizers because sanitizers get rid of good bacteria that you have on your hands that can potentially help you and be beneficial in a situation like this. So make sure you're washing your hands with soap and water. Try to, again, avoid sneezing, directly out into the open. If you do happen to contract it, we want to try to, reduce the spread as much as we can. But more importantly, nutritionally, make sure you're eating the good foods that have good nutrients in them. Stay away from inflammatory foods, processed foods, fried foods, saturated fats, trans fats, those kinds of things. Those reduce your immune system. You got to make sure you're sleeping adequately. That's also really important. When you don't rest well, your immune system decreases, and that can leave you more susceptible to acquiring an infection. So I want you guys to know that in our practice, we're doing a lot to help our patients. We offer something called the Myers cocktail, which is an extremely potent immune boosting intravenous multivitamin cocktail basically, and it's vitamin C and lysine and B complexes, and these are things that we also carry in supplement form in order to help people in acute situations or to again boost the immune system up and be kind of preventive in nature. So there are some things that you can take. As I mentioned, lysine is very good to fight against viruses. There's a lot of herbs that you can take, astragalus, adaptogenic herbs for the adrenal glands if you're feeling kind of fatigued and run down. Those are the people that really at this point want to try to make some positive changes, because if you do have anything immune system wise going on, if you have autoimmune conditions, if you have really severe stomach problems, you are the population that's going to be a little bit more at risk for complications from this virus. So if you guys have questions about what's going on, we're on top of the research, we're on top of all the new stats coming out. We help people with viral conditions nutritionally all the time, people with autoimmune issues all the time. That's really what our bread and butter is. So again, if you have questions, there's Americans now saying that they won't even drink Corona beer anymore just because the name Corona. So again, I want to calm the hysteria down a little bit. Make sure you guys know that it's okay, all right? Remember the swine flu, and remember Zika, and remember bird flu, and remember SARS. There's a lot of hysteria going on right now. Don't be a victim to that. You can still live life normally. Just take the proper precautions, and in the event that you do get sick, getting adjusted, taking the right vitamins, minerals, herbs, supporting your body, your immune system, that's going to improve your chances for better outcomes as much as possible. So drop questions, drop comments. We're here for you guys. This is Dr. Ray, aka Dr. Frontier, saying have a great day and don't worry so much about that coronavirus.